Good evening, ladies and gentlemen. I am Prabhakar. In today's conversation with Achievers, I am in Vizag and I have a very special guest, Dr. Raghu Vamsi. He is a senior consultant cancer surgeon and a laparoscopic oncology surgeon, MBBS, MS, M.CH, MRCS and FALS. He has been a leading oncology surgeon in Visakhapatnam, and he has 14 years experience, and during this conversation we will come to know a lot about cancer care and cancer treatment. Welcome, Dr. Vamsi. How are you doing?
I'm doing good, Andy. Thank you so much. Thank you so much for having me.
Yeah, coming straight away to your medico days, did you want to become always a doctor, or you had some other options and then you wanted to become a doctor later?
To be honest, I mean, I never probably thought directly that I would want to become a doctor. There were two factors which were easy. One, of course, my father was an ophthalmologist, eye specialist. So there was this tendency to become a doctor. And another easy thing was I never liked maths or physics. So that made my decision easy to go into biology, and then of course, and slowly I was always inclined towards becoming a doctor, I believe.
Okay. I know from my days, that is mid-70s till date, medical entries is considered to be one of the toughest to crack, and it is really much sought after course in India and as well as abroad. So how did you prepare for your medical entrances, and was it a cakewalk for you, or also you struggled?
Not at all, not at all. Just as you said, medical entrance is among the toughest exams to crack, like IIT or civil services. It is among the top exams, and it requires a lot of dedication and hard work and proper training. So it was not at all a cakewalk for me, and I did have a difficult time. I did work hard quite a bit, and there were various factors which were involved in cracking the entrance at that point of time. So yes, it was definitely not easy, and the whole point is to focus on the subject, work hard, try to prepare well for the entrance, and yeah, that was how it went.
Where did you do your MBBS from?
MBBS was from Pondicherry University.
Pondicherry University. Yeah. And then after that, did you work or go for MS street?
No, I directly. I mean, there was a year of preparation in between. Usually, it so happens that yes, if you're lucky nowadays, you can directly transition within a few months. But my internship got over somewhere in August, so the next academic year was always in April. So during that period I had to prepare again, and I got into MS General Surgery through All India. Yeah, so that was how it went.
So after doing MBBS, you have two options of either going for MD or MS.
Yes.
And what is the reason for opting for surgery over MD?
I was very clear maybe by the end of my final year, and as soon as we start internship, we have 1 year of training in all departments, general surgery, medicine, gynecology, obstetrics, pediatrics, all departments, specialties. Everyone during internship we get trained in that. So I was very clear from the beginning I wanted to be a surgeon. The only question was whether to become a general surgeon or an orthopedic surgeon. That was my dilemma at that point of time. But I think surgeons are made from a different kind of a cloth. It is usually easy to identify a surgeon from a physician, the nature of people. So usually surgeons tend to be more aggressive, more proactive. Not that the physicians are not proactive, they are brilliant in their own way, but surgeons have a knack for interest in operating, doing surgery, working with blood and all that. So yeah, that was the reason. I think I always, from the beginning, I was always attracted towards surgery, and that is how I pursued it. Yeah,
in fact, as you said, that every field of profession requires its own special skills.
Yes.
But I always feel the surgeons require some more extra skills, as well as mental toughness and super concentration and patience and whatnot. So what it really takes to be a good surgeon?
That's a very good question, sir. So it is true what you said. Definitely surgeons, I don't want to say they are superior or something, because all fields of medicine have their own value. But as you said, there are some qualities in surgeons which are very essential as such, they have to be tough. They have to be dedicated, more hardworking, more physical work also, and directly dealing with the patient's body. One small mistake here and there during surgery costs the life of the patient. That can happen in many of the surgeries. So they have to be really careful, as you said, focused and concentrated when they are on the job. So that is also the reason there is a lot of training that is required to become a surgeon, and there is a full system that runs into becoming a surgeon. So yes, that is in many ways these are some of the factors which will, unless you already have them in you, it is rare that they do go on and try to become, or they try to pursue surgery. Usually people who are already this, I mean, they want to work hard, they want to stand long hours, want to operate on patients for a long duration, are willing to put their hands in blood and work and handle these situations. So those are the kind of people who are more inclined to go towards surgery, and then that's how it goes.
So do you do any special sort of exercises or mental meditations or yoga, anything special to focus when you operate?
It's to be honest, people who are passionate about surgery, there are to be honest with you, there are people who still end up becoming surgeons who have really not decided or wanted to be surgeons upfront. They take up surgery and slowly then they develop the knack and so on. So those kinds of people are also there, but in general people who are passionate about surgery, who keep pursuing surgery, who try to improve on their surgical skills and go to the next level, as I have done with laparoscopy and then robotic and so on and so forth, even in oncology. This is usually done for general surgeons then, or gastrosurgeons, they do laparoscopic surgery and so on. Now laparoscopic and robotic surgery has come in a big way, even in oncosurgery. So as people whoever is passionate, and we were all my friends, and we all know how we are always running around. Even at midnight you ask us to operate a case, during our PG days we used to run and be the first one to be there to assist and operate and learn, and that is how all the passionate surgeons are. So we really don't, as of even then and even now, there is no special preparation as such. Because to be honest, if you're really focused into surgery and when you're doing the surgery, it is a kind of meditation. That itself is a kind of meditation, because you're zoned out, you're not thinking about some other 10 things, what's happening at home or what you have to do later, this thing. You're focused on the surgery, and that is when you're also getting the best results. So for me, it is a kind of meditation in itself.
After MBBS and MS, I understand you've done some specialization courses. Can you explain something about them?
Yes, super specialization. Today, MS General Surgery and MD General Medicine, they are called as broad specialties. That is like a bridge to the next level, because science has developed, medicine has developed in a big way. So you have a specialty for each organ technically, cardiologist, nephrologist, neurologist. Similarly, you have a cardiosurgeon, urosurgeon, urologist, then you have a neurosurgeon or gastrosurgeon, like that, oncosurgery. So that is after doing my MS General Surgery, I was interested in oncosurgery, and I worked at Tata Memorial Cancer Center, Mumbai, and later I did my M.CH in surgical oncology at SWIMS, Tirupati. I was always, of course, interested, even during my M.CH, I was always interested in the newer technology or adapting newer technologies into our surgery and so on. So during my time, laparoscopy was still in the beginning in oncology, because people were afraid to do laparoscopic surgery in oncology. It was quite common for other general surgery or gastro cases. So that was the time we started doing trials whether doing open surgery or laparoscopic surgery would be beneficial for say a uterine cancer patient. Me and my colleague, we did trials of which would be more beneficial, and those were the times it was happening, so 15 years back. So now laparoscopic surgery has become a part, and that is what I've upgraded myself and got myself certified. I've done more than 200 laparoscopic surgeries. So that is the qualification. FALS is fellowship in Advanced Laparoscopic Surgery. And of course, even before M.CH, I was a member of Royal College of Surgeons, MRCS. That was just an additional certification of my work.
Excellent, excellent. Now, coming to this special stream of oncology, I think when you became MBBS and when you were doing your MS, maybe you had various options for going to other streams, but you chose to be an oncologist. And for a non-medical persons, everybody is scared by the word cancer itself. And all the patients who come to you, unfortunately, are at a critical stage. Maybe 1 to 3 is fine. Maybe nowadays there is a remission, but many patients may come even at the stage of 4th, where almost they are on the verge of going away.
Yes.
So, why did you choose this oncology, where you have to handle only critical patients, and does that put a pressure on you?
To answer your question, the last one first, to be honest, no. I don't feel any pressure or really stressed out, doing my work, because I just love it. I have passion for it, and that gives me purpose and the opportunity to help a lot of people. That is the kind of position God has blessed me to be in. So I am very happy and I appreciate where I am. The choice of becoming an oncosurgeon, as I told you, during my MBBS I was clear that I wanted to be a surgeon, and we all knew by that time that surgery was just a bridge to go into some other department. Somehow I was never pulled towards other more fancy or more attractive specialties, because cardiothoracic surgery was always a big name in those times. When I was doing MS, people used to, okay, if you're a cardiothoracic surgeon, that is the peak of a surgeon. Similarly, gastroenterology. But somehow oncology I had a thing for oncology. Inherently, I was always pulled towards it. One reason, of course, was the fact that I would be able to operate on all different organs and provide my services or use my skill for different kinds of patients, or not confining myself to only one category or one organ system. So that was one aspect. And I always had the knack for picking up challenges. So whenever someone said, you couldn't do this, I would always feel like, okay, let me try this. So even my father, for example, he was, he never had any partiality towards any of me, but he always felt my brother is the smarter one, so he wanted him to become a doctor. So probably that was another reason I also became a doctor.
Did he become or not?
No, he is a very good programmer, doing well.
He's gone into IT.
Yeah, he's gone into IT sector. Typical, yes, of course. He is very passionate about his coding and programming, making stuff. We are also dependent on them. They do a lot of programming, and the machines we use are coded by them. So yes, his inclination was towards that. So anyway, that is how I felt. Probably these were some of the reasons that I was drawn towards oncology, and I felt this is a field which will grow quite a bit, and my passion to develop it both surgically and clinically. In medicine wise, there is a lot of scope for developing more treatments and better outcomes in oncology. So I think that was the reason I took up this field. And another small correction, I would, as you said, critically ill patients. Critically ill means people who are in the last stage. Yes, there is a substantial quantity of patients who do come who are critically ill in India, unfortunately, because of our poor socioeconomic status and neglect because of poor understanding. But still there is a good quantity, good number of patients who I deal with on a daily basis who are getting cured. I have operated 3 patients today, and I can assure you all 3 will be cured. So there are similarly lots of us, at least 10 to 12 surgeons in this place. Every day we operate 2 or 3 surgeries, so almost 30 surgeries every day in Vizag, with a potential, say at least 20 to 25 of them with the potential of cure. So that is the kind of outlook we look at, not the unfortunate grave outlook where patients, or in the general media the outlook is for cancer. Because yes, out of 100, if you see, probably 50 or 60, yes, they do get cures and they do well. But we get to see both sides, so we focus on the good aspect, positive aspect.
And though I don't have the statistics, but in general perception is that, for general perception, it must be true that there is a phenomenal increase of the number of cancer patients these days, not only in India, around the world. And what is the reason for that? Is it attributable to poor immunity, or lifestyle, environment, or adulterated food, or a combination of all of them?
Yes, it is true that there is to be a tremendous increase in the number of cases in cancer cases all over the world, and more so in India of late. And recently there was a study put out by WHO. They have made an observation that India is going to become the cancer capital, yes, unfortunately, of the world in 10 years, 2035 or something. So 4 or 5 years, yes. So whatever it may be, it is not a good thing. The reason for the increased number of cases, yes, primarily what we can attribute to immediately is the lifestyle, definitely, because among the risk factors for many cancers, the general epidemiological studies, they have shown that almost up to 60 to 70% cancers can be reduced just with lifestyle changes. So today, cancer is considered not as some dreaded disease, but it is a part of your lifestyle. It is a effect of your lifestyle. So just like diabetes, hypertension, or cardiac problems, cancer is also a lifestyle disease which can be controlled to a great extent with lifestyle changes, be it diet, exercise, other habits which you have, controlling stress, etc.
So apart from the increase in the number of patients, this is also seen that earlier, whenever we used to listen about cancer, very rarely people used to get cancer in those days, and that too also an advanced age, maybe 50 plus or so. But like heart attacks and other things, now it has come, even cancers are coming to very young patients of 20s, 30s, even 40s. 40s have become a common thing. What is the reason for that? Actually, younger people are also getting cancers.
Yes, it is an unfortunate thing that, but it is true that a lot of patients are, cancer patients are young now. A lot of young patients are also getting cancer now. See, cancer, most commonly we divide them into the risk factors for cancer. It can be either genetic or environmental. Genetic is some changes which happen in the body which result in developing the cancer. Most commonly that is hereditary, which runs in the family, that causes up to 5 to 10% of these cancers. Somatic mutations, that is, as such, some mutation can happen in the person without having it run in the family. Inherently, it may start in one person. Those are called as somatic mutations. Those can also occur and cause cancer. These may be some of the causes for the younger people having cancers. Beyond that, the lifestyle, as I told you, environmental factors includes these lifestyle factors predominantly, and unfortunately we see there is a rapid change at the global level. If you can see, especially in India, the habits which are changing over the past, rapid change over the past 15-20 years. So I think that is one of the reasons that there is a sudden increase in these number of patients, and slowly the number is only going to increase because we are not going back to what our old system was. There is a lot of pollution, there is a lot of adulteration of food, lot of chemicals everywhere, be it the items which you use daily, toothpaste, soap, shampoo, the food you eat, whatnot, anything you touch, it is chemical. But the milk, there are hundreds of videos which you're seeing, milk is not available, they're just making it out of chemicals. So we really don't know what is good or what is not. So yeah, these are some of the many factors which are there, which probably are causing the sudden increase in younger population also.
Another phenomenon which you have seen, I have certain personal experiences also, that whether it is rich or poor, younger, old, many times, that when the people come to a checkup, or ultimately, unfortunately, when it gets detected that it is cancer, it's already third stage, even some fourth stage, right? What is the reason for it? People are not going for checkups, or some of the symptoms are not getting manifested in the checkups, which are taking them to maybe from first stage to the fourth stage, and only then even somebody like Yuvraj Singh, as a third stage he got detected.
Yes.
So those guys, a cricketer, not only he goes for regular checkups, even BCCI has so many checkups. True. And in his case, it could not be detected. And then at the third stage, there was a remission in his case. Like some film stars, like Irfan Khan and other people, I think it was detected at the fourth stage and he didn't survive for more than 2 years. So what is the reason for that? As a doctor, can you pinpoint any reason because of which people are getting detected at advanced stages?
To be honest, we cannot pinpoint a single reason that this is the reason, because see, what people think is cancer is one disease.
Okay.
It is not. Cancer is an amalgamation. It is like 100 diseases put in together. Okay. It is a single label which is given to all these different kinds of, because any part of your body can develop cancer. Almost every organ can develop cancer. What is cancer is, it is just an abnormal behavior of your normal cell.
Okay.
What was normal till now and behaving well and healing well in your mouth, suddenly some change. Say you were smoking BD for 10 years, or you were having chewing pan or having alcohol. So it made some changes slowly, and one fine day the cell says it is done, and now it changes and it starts behaving aggressively, forms a growth. Okay. So that is what it is. It is not something which gets from outside, but it is an internal change which has happened over many years usually. Sometimes, as you said, be it Yuvraj or some young people, it may be sudden, or something which has come out suddenly, some genetic change without any reason. It might also happen. Okay. We cannot really pinpoint what is the reason.
Okay.
The problem with the main issue about diagnosing at stage 3, stage 4 is there are many cancers which can be cured at stage 1 and stage 2. People should be aware that yes, this can be cancer and we need to get checked. This awareness was lacking quite a bit. Now there is a lot of awareness campaigns going on. So yes, I'm sure in the next few years it will improve, because in the US they find breast cancers, for example, approximately 70 to 80% of them are in stage 1, 2. India, it is exactly the opposite. We have almost 70-80% of our population in the villages. So it will take time for them to understand this, and to it has to go into the grassroots levels and for people. In the cities, in the urban life, yes, there is improvement and people are understanding. But most importantly, there are some cancers which you can easily identify, and definitely any person can identify in the early stage, be it oral cavity cancer, throat cancers, thyroid, breast cancers, any lump on the outside. All these cancers are very easily identifiable early. Some cancers are difficult to identify. Like for Irfan Khan, he had a pancreatic cancer. Okay, so pancreatic cancer is quite deep in the abdomen, it cannot be found. Similarly for Yuvraj Singh also, there is a mass which developed in the chest. So that mass usually takes a little time to develop, and it may not be seen on the routine test done on X-ray. Unless he develops some symptoms. So by the time he develops symptoms, it's already grown more than 5 or 8 centimeters. So for a healthy person, mild symptoms he may not even notice. So that is how it might have skipped. So yes, there are some cancers which are not so easily identifiable. But as you said, regular health checkups, knowing your family history. See, there are many people who neglect. Today, almost every other or every third family has a patient or a person who has had cancer. So it is time people understand their family history. If anyone in their family has had cancer, know the causes. Today, genetics has come in a big way. We are able to identify various genes which may result in these cancers. So you can get yourself tested for these genes if it is running in your family. Identify the gene, and then consult an oncologist and follow their guidance and catch it early, or even avoid it if possible. So that is one aspect. The easily identifiable ones you should be aware of. Yes, there are still a few which cannot be identified at an early stage. So that I'm sure more genetic and special tests will come out in the future to identify all cancers at an early stage. But it's a long process, which I think we are all the oncologists, we are in the process of helping and trying to spread this awareness that people have to be aware of these symptoms and so on, because there is no single symptom which will say, okay, this is cancer, for the patient to say, okay, yeah, I have cancer, I may have to go. And so people should know that, okay, these are some things which I should not neglect, and these are the things I should consult an oncologist for. So a simple guideline which I tell all my patients or people wherever I have my own channel where I try to spread this awareness. So I tell them, don't sit on any symptom for more than 2 weeks. If there is a symptom for more than 2 weeks, one, consult a doctor, and after consulting a doctor, if after another 2 weeks your symptom is not cleared, especially after treatment, definitely consult an oncologist. Because we have an eye for this thing that, okay, for example, tuberculosis and lung cancer, they mimic each other, they look alike, or they have some symptoms which are very similar. Both of them may have cough, both of them may have sputum, they'll have blood in the sputum, and so on and so forth. But even after 2 weeks or 1 month of treatment for TB, there is no improvement. It is better to consult an oncologist and check if there is any underlying cancer which has missed, something like that. So similarly, there are many people who have ulcers in the mouth, they keep on leaving it for months together. Any ulcer which is not healed, especially painless, people always wait for pain to come. A big myth is they feel, okay, only if there is pain it is significant. Not at all. Most of the cancerous lesions, be it an ulcer or a swelling, most of them, especially early stage, they are painless. If there is pain, it may not be cancer actually. So if you have an ulcer in your mouth which is painless, not healing for 2 weeks, directly you can go and consult an oncologist. Your doubt is cleared, and if it is positive, you have a very good chance of cure. Similarly for lumps in the breast, do not neglect it. Previously we used to say till 50 you can need not bother, but now with the family history, with the number of cases we have, should be aware if there is any such risk. Even otherwise, consult an oncologist, get yourself tested. It is all the more good if it is negative, you are happy, the doctor is happy.
Yeah, that's my next question is the same thing. As a layman, I'm asking, of course, as you said, that the patient should always come to a hospital and consult a regular doctor first, then immediately go to oncologist. That is one thought that never crosses the people's mind, that I should go and consult an oncologist. And should the patients or the doctors go for aggressive tests, that means going through all the tests, whatever required, to make sure that there is no cancer? Because as you know that we had a history in our family. Unfortunately, in our case it was reverse. We have been telling to the doctor that go for all the tests. For some reason, doctor didn't say there is no need. As you said, just they had the perception that people below 50 or 40 will not have a cancer at all, and my daughter had it at the age of 26 itself. So seeing such cases, maybe there may be a few more cases like that, or many more cases like that. So should the patients as well as the doctors go for all the tests, maybe biopsy or even a CT scan, to make sure that there is no cancer, even if it entails some expenses, because nothing important more than a life. So do the doctors take that line, or wait for some tests to be done, then ultimately go for all that biopsies and scans, and ultimately then they themselves also find surprised that it's a cancer? How it goes normally?
Yeah, to be honest, it is unfortunate with your situation. I can understand, and I understand from where you are coming with this. But it would be more of a knee-jerk reaction if everyone gets all the tests done. It is already, there is a perception, that the hospitals and doctors, it's purely for commercial reasons. Some tests are being done. So this will only worsen that kind of a perception. And it will always give chances for people to, unnecessarily commercialize the thing where it is not required. So as an oncologist, I mean, there have been studies even for tests like a mammography, where they have extensively tests being done, whether it should be done en masse for the population, because it's a screening method which will identify breast cancer at an early stage. It is likely to identify. So they have done, this testing, trials, randomized trials, even in lakhs of women, and then finally they have come to the conclusion that there is a specific group of people where it is most beneficial. Otherwise, it is not cost efficient as a program on a country-wide basis or a state-wide basis also. So there is no, but still mammography is considered as a screening test, which is indicated for specifically for all women above the age of 40, for any woman high risk above the age of, all women above the age of 50, and all high risk women above the age of 40. Similarly, you have screening test for lung cancer, which is low dose CT scan, only for smokers. Then you have screening test in prostate, which with a prostate specific examination by a doctor, and a PSA test, it's a tumor marker for prostate. Then we have a specific screening for colon cancer, that is large intestinal cancer, with a colonoscopy and a fecal Tucker blood test. That is also for high risk patients. Who are these high risk patients? Suppose for breast cancer, you have had a history of cancer in your mother or close relative, or someone who has a family history with cancer with a proven this thing, then you get this screening done. Okay, so similarly we have high risk category for each cancer, but that will people will only know once they consult the doctor. This whole reason is, that is what I am telling you. Do not neglect on any symptom for more than 2 weeks or a month. Okay. So even if you have consulted one doctor and there is no improvement, kindly get a second opinion. There is enough doctors, get more specialist opinion. So in that ways, there is the chance of missing these kind of, because yes, I don't blame the general doctors. See, they are seeing 100 patients, they may see one cancer patient.
Yeah.
So they won't be doing all tests for all 100 patients, and the remaining 99 to catch this one patient. If it is obvious with the symptoms, yes, they will catch any patient because they are all qualified. But the general practitioner may not be able to identify some cases. But after 2 weeks or a month of treatment with them, if there is no improvement, now it is time that they can directly consult an oncologist and just rule out if there is something which they have neglected, they have missed or something. So doing a whole battery of tests, because there is no specific test to definitely say, I mean there is single test to say, okay, this person has this kind of cancer. If you have symptoms, say if that person has symptoms in the lungs, then we'll do a specific test for that. If they have symptom in the abdomen, then we'll do specific tests accordingly, and then find if there is any cancer related to that symptom.
Okay. So in our lifetime, you have seen diseases like polio, TB, and other things have been eradicated almost completely from the world, and especially in India, and the vaccines have been developed. So what is the scene in cancers? Is there any vaccines for cancers also, and can we see a day in life that where almost cancer is also, if not eradicated, reduced to a great extent?
I am a very positive person to be honest, so my ideal world would be the one without cancer at all. But I am sure because see, usually the world changes in such a drastic way which you cannot imagine. If you told someone that we'll be holding a small block, say 50 years ago or say 100 years ago, and say there will be a block with which you can see and talk, watch them on video and talk to someone say 1,000 miles away, no one would believe. They'll say it is magic. Okay. So in the same way, I am sure 100 years from now there might be something which, by that time, cancer may not be a word. Okay. So I am hopeful and positive something will definitely come up, because that is how life goes, I feel. And coming to the vaccines part, I can happily and proudly say that at least 2 vaccines are available today that can prevent 2 types of cancers for sure. That has been proven already. One is cervical cancer, that is cancer of the lower part of the uterus in women. So young girls, before they are active sexually, from the age of 9 to 25, they have been advised to take this vaccine, and it has shown to prevent invasive cervical cancer in them. Similarly, HBV, hepatitis B virus, that is one of the viruses which causes hepatitis in the liver, that is liver inflammation. So that is one of the causes for liver cancer. Over long term, these patients develop liver cancer. So we have found a vaccine for that virus, and it is also a part of our national immunization program. So almost every child gets this. So the chance of developing this infection and cancer is eradicated. So let us hope we find more vaccines or more methods to cure cancer in the future.
Now, as of now, to my understanding, cancer at the stage 1, 2, 3, there is a remission if it is attended in time and of course good treatments are taken. What about the fourth stage? In any future, can fourth stage cancer be can be remission in fourth stage as well or not? Any research going on that?
See, as I told you, cancer is a whole entity. It is not a single disease.
Yeah.
So there are different stages. I mean, organs where the cancer is involved. For example, oral cavity. Fourth stage is only when it involves the bone or skin. Even then, it is called fourth stage. Okay. But technically, what people mean by fourth stage is this cancer, which is, or what we also mean is cancer which is there at one place. It spreads to other organs. So that is the kind of cancer we are talking about. So there are some cancers in which even now, at stage 4, there are remissions. Okay. Some rare, but the numbers are not so huge that you can give them a guarantee. So large intestinal cancer, that is colon or rectal cancers, even stage 4, where there are multiple liver metastases, we have got wonderful medicines now, and the surgery has developed so well, and additional treatments have developed so well that previously what used to be for a stage 4 cancer, the survival, we see survival is the chance of the person surviving for 5 years. That was around 5 to 10%, and it is around that range or less than 5% for many gastrointestinal cancers even today. But for colon cancer with advanced stage, it's up to 35 to 40%. So out of every 10 patients, around 3 to 4 of them can be cured of the cancer in colon cancers. Similarly, some ovarian cancers, some rare breast cancers, if they are not extensively spread, they can still have a chance of cure, but the percentages are very low, somewhere in 15-20% or so on and so forth. Advances are coming now, even in breast cancers. 10 years back, we could never say this, that okay, in stage 4 you will have some very good result, but there is a subset of breast cancers where they have a receptor called as HER2/neu. If that is positive, we have wonderful drugs now where we have seen miraculous cures, and they'll have tumors all over their body. Whole lung is studded with tumors, liver is studded with tumors, bone metastasis everywhere. You start the drug, it is not for every patient, but a good number of patients. You start the drug, and there are many cases where they have completely vanished.
That's excellent.
So there are good success stories. But I hope it is just the tip of the iceberg, and in future we get further better treatments. And my most passionate work is actually towards preventive oncology, and interest is because the best way to cure cancer is by preventing. Okay, so let us hope the changes also inculcate into the daily habits of people, and people are able to form habits where the chances of getting cancer itself is reduced.
Now coming to the surgery, your specialization area, in the cancer patients, does surgery is always beneficial to the patient at whatever stage it is? Because surgery means taking a part out of the body.
Yes.
Especially I have seen some throat cancer patients. In case of some boys, boxes are taken out, and then intake of food is also very difficult for them. And sometimes, unfortunately, after doing all those things also, they don't survive. And in many cases, again coming back to Yuvraj Singh example, when that lump was taken out, he's so physically fit that he played test cricket also, one-day cricket also. Even last month, in fact, I had a conversation with him online. So he was playing in Sri Lanka at this age. He must be 40 plus now. After cancer, third stage cancer, he's still playing cricket. So in what cases surgery is beneficial, or in all the cases surgery is beneficial?
To put it simply for people to understand, see cancers, as I told you, it's a diverse group of diseases. So any solid organ cancer, that is whenever there is a tumor, a solid part, so for most of them, 95 to 99%, surgery is the primary treatment. So you start with oral cancer, throat cancer, thyroid cancer, esophageal cancer, stomach cancer, liver cancer, pancreas, large intestine, kidney, urinary bladder, sarcomas, tumors in the bone or in the soft tissues. So anywhere you have a solid organ, as long as you are able to operate, that is the best thing. Today, what over research, over years and years of research, what we have found is only surgery is not sufficient.
Okay.
Additionally, chemotherapy, radiation, both of them may or may not be needed depending on the stage. So even with third stage, as you mentioned, where sometimes surgery is not possible, you give this chemotherapy or radiotherapy, reduce it and then operate, you are getting a very good result, almost as equal to first or second stage. Okay, so that is possible for some cancers, especially ovarian cancer and rectal cancer. These are very two classic examples where stage 3, you give some form of radiation for rectum, chemotherapy for ovary, then they become operable, you operate and they get wonderful results. So yes, surgery plays a very important role in all solid tumors. Even lung cancer, if you're able to identify in stage 1, then surgery still is the best option. Okay. Liquid cancer, that is blood cancers and some other kinds of cancers, that is where only chemotherapy plays a very important role. Okay, so that is what we need to know about surgery. Surgery plays a very important role even in stage 4. For example, people who have advanced cancers where they are unable to eat, we need surgery to make them some form of system where they can eat. Then if they have obstruction because of tumors and intestines are blocked, we may have to relieve it. So surgery plays a symptomatic relief role in these situations. Okay. So but primarily all cancers where there are solid tumors anywhere, surgery is the most important part of the treatment. But today it is one of the part because chemo and radiotherapy have a very important role and they are doing very good. And of course we have additional treatments today known as targeted therapy, where only specifically those cancer cells are targeted, immunotherapy and so on and so forth.
Okay. Now for every disease, apart from allopathic treatment, we have the different forms of treatment like Ayurveda and homeopathy is very popular. And I understand a lot of people are claiming that there are some medicines in Ayurveda as well as homeopathy. In fact, in Delhi there is one gentleman, one doctor, and we had to wait for 4 months to get his an appointment, and he claims to have specialized apart from all other treatments, prescribing medicines for cancer patients. We tried that also. So, but what I heard from the allopathic doctors, that is oncologists, saying that as long as you are taking the chemotherapy treatment and other things, don't go for any other alternative things. So is it because of the allopathic people never prescribing other forms of treatment, or does it obstruct the chemotherapy treatment if you take some other forms of medicine? And in future, can there be a synergy between all these people? Allopathy, Ayurveda and homeopathy.
I wish the answer could be yes, but as of today, to be honest, I am not a qualified person to say that, okay, because unfortunately there is a tendency for homeopathy or Ayurvedic people to comment on others. I don't know who does or who does not, but in general the perception is like that everyone comments on allopathic treatment. But because I am qualified and I have seen, see, what people need to understand is how did allopathy come into being? Okay. So they have done research over research and see, whatever drugs today I am claiming this will give you 100% cure for this cancer, we did not have it 10-12 years back.
Okay.
1998, the breast cancer patient with these reports would have a cure rate of 80-85%.
Okay.
The same reports today you get the patient, we are able to get a cure rate of 95 to 98%.
Okay.
Okay, for a stage 1 or stage 2 cancer I am talking about. So that is the development of cancer drugs, cancer treatment, breast conservative surgery, where previously we used to remove breast for everyone. You call, there is a 0.5 centimeter tumor, remove the whole breast. That was the treatment 20 years back. Now past 5-10 years it has become radically different. We are able to conserve breast and get the same outcome. Okay, so that is a very big thing for all the women who have breast cancers. So the surgery people are easy, it is easier to believe because people are able to see the results. Chemotherapy people are afraid because of the side effects, but today they have come down in a big way. Radiation also they are worried about the side effects, but primarily the technology has improved in a big way. So I would definitely vouch that these treatments are available only when an oncologist tells you that okay, there is no option for us, or these are the options which may or may not benefit you. Then you have a choice. You can definitely go and try other forms of treatment, because one thing I'll assure you, see, I have operated on more than 4,000 patients. Definitely more than 2,500 would be early stage cancers. I have all of them on follow-up, and I can give you the names and of the patients who are doing well.
Great.
Can the same be done by any homeopath or allopathic patient? Yes, to be honest, even I have heard of patients stage 4 where we have given up, and there are patients who have gone to Ayurveda and then they claim it is totally cured. But not a single patient of mine so far it has happened. But even my own patients, when I have no option to give them, I tell them you go for any naturopathy, allopathy, homeopathy, whatever, Ayurveda, homeopathy, whichever you believe, because I don't have much of an option here which will have a chance of cure or which may be beneficial. Whatever the claims, to be honest, I have seen are of most of the patients who have undergone some form of treatment with us. They are actually cured here. The surgery and radiation is done, but because radiation has taken a beating, the body has taken a beating because of radiation, they go to homeopathy and take some medicines, and then they claim, okay, because of radiation I had so much difficulty, now after 6 months I am doing good. Even without homeo, they would, or Ayurvedam, they would have improved over the next 6 months, because that is what I am seeing with many of my patients. I feel even irrespective of homeo or Ayurvedam, if the patient has to have recurrence, he will. So that is something which is debatable, so I am not going to put my foot down on something. The only reason I am saying is whether we have enough proof. So if a specialist doctor is going to come out and say, okay, I have these 100 patients who have gone to these many hospitals and come out with data, and I think it is time then even because everyone wants to treat the patient and cure the patient. So definitely a synergy can be brought up, and it is time that people who are claiming these, not just for the advertisement sake and popularity, they come out and do it in the open and show it enough data, do research and help both the patient and the community.
That is what is lacking in other forms of
exactly, because here today you ask me, we have guidelines for everything. I cannot just write some drug because I feel like it. Okay, I am an oncologist. There is a specific drug for breast cancer and there is a specific protocol, and that is the only way we have to treat, and it is an international guidelines are available. Every country, every state we have their own guidelines, and every hospital form their own guidelines. Yes, there may be 2-3 options, among them we choose. But are there similar guidelines put up in allopathy or homeopathy or Ayurveda? I don't think so. Of course, they work on a different level. To be honest, see, I don't see anybody who has an accident on the road going to homeopathy and getting treated, because they know they need the surgery, they need the emergency. See, there is no treatment for emergency in homeopathy or Ayurveda. So all I'll close by saying is cancer is an emergency. It is not something you go and try other medications.
It's not a cosmetic treatment.
Yes, it is not a cosmetic treatment. Cancer is always an emergency. The earlier and the first best treatment you get is the best shot you get at final outcome. Unfortunately, it is a disease where, as you said, many patients come at stage 4 and there are a lot of bad outcomes. As you see today, see, something goes bad, that person is going to go out and say, oh, this went bad, I went for treatment, this went bad. But instead, for that one person, there are 20 other people for who got treated and cured. Unfortunately, only 2 of them are speaking, or they may not even speak unless someone goes and asks, or they're nearby neighbors, because there's always a stigma that, okay, I got treated for cancer, even if they are survivors. In India, especially in South India, what I've seen is there is still a stigma. Cancer survivors are not coming out and talking about the kinds of treatment they've got. Yes, the chemotherapy and radiotherapy have side effects, but enough number of people have gotten cured with these kinds of treatments, so it is not something that can be kept aside at all. That is one and the only proven form of therapy. The other drugs should not be taken with this, because we don't know what side effects these Ayurvedic or homeo medicines cause, because they are not simple, and they cause some change in your system. From what I understand, Ayurveda and homeopathy, they work in a homeostasis level. That is, they stabilize your whole body's system. Say they have this, if your body is heated up, they cool it down, or something like, to put it in layman terms, that is how these kind of medicines work. So it may help in the general overall immunity also, some of these medicines. But will that really cure cancer, which is a tumor which is there in your breast? No. You get it removed, get all the treatments of chemotherapy and radiotherapy which have been proven to cure cancer, which give you a probability of 80% or 90% cure rate. Beyond that, if you believe that homeo or Ayurvedic may be helpful, you can definitely take that. So during the treatment, it is not at all advisable to take any additional treatment. That can be done after.
Okay. That's really very useful reply you have given. It will be useful not only the cancer patients, for all other patients, that they should mix up two forms of treatment.
Because we, one, definitely it is not proven. Two, we don't know what side effects it causes. No one has even studied whether a treatment which is working and then you take some other treatment, maybe this is stopping this treatment from working.
That is what I'm saying.
That can also clash.
That was what I asked in the video. Now coming to the very important aspect of it, the cost part of it. I think of all the treatments, cancer is the costliest treatment. One, of course, unfortunately the patient suffers, and more than patient or equally along with the patient, the family suffers because of huge financial burden. Almost people get bankrupt if they are not insured, or in some cases there is no reimbursements. So is it the cost is so high because most of the, I think to my understanding, most of the drugs for the cancer treatment are still being imported. So that must be adding to the cost of our treatment. And what is the probability that in the near future these drugs can be manufactured in India as effective as the drugs being imported, and the cost being reduced?
It's a very valid point that the cost of the treatment for cancer, it is, yes, I would not say it is a cheap treatment, it is a costly treatment. But if you compare it to the Western population or in the West, here in India it is actually a fraction of the total cost. It is quite cheap. But for the Indian population, for some parts of the population, it is still costly. We have a lot of programs, especially here in Andhra and actually many places in India, where there are government schemes where lots of poor patients are getting treated for free. So that is one good thing that is going on. The reason why it is so costly is the research that goes into all these drugs. There are lots of money which is involved and how these drugs are developed. So over time, once these come into the market, over time the cost definitely gets reduced. Because what is glaring is usually the chemotherapy, but the newer drugs which come, they are usually costlier, and slowly they come down. But now in India also there are lots of companies where the trials are going on, and what we call as biosimilar trials, like the parent drug where it has the patent. After some time the patent is gone, and then biosimilar drugs are made. The cheaper ones are made by various companies, and they are available now. Of course, again, the patient may or may not believe that this is so effective. So that is there because there is a drug, for example, olaparib, which is given for breast cancer patients who have this gene positive BRCA1 and 2 positive. The original molecule which was initially found out, that's more than 2 lakhs or so per month cost. Now an Indian company, NATCO, has come out with something which is around 15,000. So things are developing. It is not just the chemotherapy, of course, the radiation, the machines, there are huge machines which are being put, and the duration of treatment and the technology which is involved. It is definitely costly if you go just by the amount we pay. Surgeries also, they are not so easy. They are complex surgeries. I operate for 4 hours, 5 hours on some patients, sometimes for even 7-8 hours, depending on the kind of surgery. So yes, they are, compared to other diseases, they are costlier, but I think people also should look into the insurance aspect of it. So try to get themselves insured, because that is what I keep telling people. If anyone comes to me and says, doctor, it is very costly. So I ask them whether they have a car or a bike. So if you ask anyone, everyone has an insured car, insured bike.
It's a mandatory.
It is a mandatory thing. So why is our human life not insured?
For that they expect the government to make
exactly.
it mandatory.
So it is time we take it up on ourselves too, that we insure our health, spend some amount. That's a menial amount on a yearly basis. It is 10 or 20,000. For the private insurances, yes, you may get government support, you will get other kinds of support, but taking that will help in a long way, because they are covering cancer and all these kinds of diseases. Because the treatments may go up with the advancements in or newer developments in drugs, there may be cost limits which may come up, and having an insurance will definitely help. Governments are doing a good job as of now. I am sure that will keep on improving. The facilities at government sectors are also improving. So I'm sure it will improve as we go forward.
As of course, what you said is, I do agree. As far as the research is concerned, the company which have put on millions and millions of dollars, they have to recover it. But other aspect is that definitely, the pharmaceutical companies abroad want to make as much of profits as they can. And I distinctly remember I used to work in Escorts group, which had a Escort Heart Institute, and in mid 2000 the stunts which are put in the heart used to cost 1.5 lakh rupees each stunt. Then I think 4-5 years back, Government of India has put a cap on that. Then not only they have put a cap, they have said every hospital has to put a conspicuously what is they are charging for the stunts. So when I used to go to another hospital for treatment of my daughter, I used to see a big board putting there that uncoated stunts now will cost only 35,000 rupees. 2005, 1.5 lakhs, and somewhere around 2010, 10, 12, 13, 14, it is now costing only 35,000 because the Government of India has put a cap.
Yes.
So is it possible, or should we recommend to the government? In fact, I have written to the Prime Minister of India and Health Minister, a lot many people sending a representation that they should put a cap even for the cancer drugs. So is it a possibility that government will put a cap on that?
It is not just only a possibility, it has already happened.
Okay.
I don't know when this letter you had put up with the government, but it has already happened probably.
Actually, I'll tell you,
3 years.
I have read in the papers,
yes,
but most of the costly drugs there is no cap. In fact, I've seen that. In fact, I was so happy. 80% of cost reduction in the cancer drugs, and when went to the next sort of a treatment, I specifically asked. Because I said, not for these. There are some drugs, there was, because I got treatment until last May.
Yes.
Nothing has happened till May. I can watch.
No, not as you said. What you said is true. The possibility in the sense that it has started.
Yeah.
Whether they have put it for everything, no.
Yes, it is not.
They haven't put it for all the drugs. They have put a cap for some common drugs which they have, listed out, and yes, it has to go. There is a long way to go ahead. I'm sure the government will take necessary actions, and as you said, the more production that happens in India and more quality drugs which we get into the market, I think the price also will start coming down.
Now, I know there was a time, maybe 30-40 years back, first heart and then cancer. Whenever people had that, who could afford, they used to go abroad, get treated, and who could not afford to go, there was not much treatments in India. I remember, in fact, one of my distant relatives got affected somewhere around the 90s. Early 90s in Delhi, there was only one hospital, Batra Hospital, who has the cancer treatment. No other hospital was there, of course, barring the government one, of course. The Safdarjung and AIIMS always had. But for the two government hospitals, there was only one hospital which had a cancer treatment, and everybody used to run to, all the rich people, film stars, other people used to rush to USA and get treated. Now, of course, right now also a lot of rich people go to US, but compared to that, the large number of cancer hospitals come to India. How do you compare? Now, are we comparable to the treatment which go in USA? Are still the US treatments or European treatments are superior than our treatments?
Frankly, I feel it's not just my feeling. I have seen that we are definitely on par, if not more. That is what I would say. because actually people have a tendency to compare with the US.
Okay.
At least in my field, surgical field, the number one country surgically is not US.
Okay.
Yes, the overall cancer scenario, they do more research and other things, but surgically the more advanced ones are Japan and Korea.
Okay.
Yeah, these are the places where the surgical advances happen, more radical surgeries, more effective surgeries are being done. In the West, there is always a divide in the East and West. Usually India has some sort of a balance. Of course, it is more towards the Korean side. Most of the surgeons nowadays are getting trained in Korea and Japan also, to improve their skills. So in that way, in surgical field, I may be a little biased, but I always feel Indian surgeons are more talented and more skillful, more equipped to handle all difficult cancer surgeries compared to the West, at least, if not the Japanese and the Koreans. Overall treatments, everything that is available in the US is available today here. The latest radiation machines, all the latest drugs. A few drugs do take a little time to come here, but they are still not in the cost-effective range. But most of the treatments which are researched and available are available. The only thing they are ahead is they have trials for almost every other cancer, big institute doing lots of trials where they try different kinds of drugs for different patients. That is not so much here in India. Here we have mostly biosimilar trials where the same drug which has already been proven to be beneficial is tried here, and a similar drug from a different company is tried here. So in that aspect, I think that is there is a lot of scope for improvement. But beyond that, if a patient is coming today, there is no need for him to go anywhere beyond India. In India, yes, here we are in Vizag. 2017-18, in beginning of my practice in Vizag, we never used to treat blood cancers. Okay, we used to send them away to Hyderabad, Vellore and Mumbai. Today almost we are sending, I think, less than 5% patients. 95% of the patients are treated blood cancer patients. So we have developed robotics, laparoscopic surgery, cytoreductive surgeries, high-pec therapy. These are all advanced treatments which we are doing even in a place like Vizag, which we only used to do previously at Hyderabad or Mumbai or so on. So every treatment is available in India and everyone can happily get treated here, and the cure rates are equal or better, definitely not less.
That's great. This question, though, I want to specifically ask you, when you choose oncology, suppose there is other forms of the other doctors. Say, take an example of a gynec. So 100% of the people come to him with a lot of hope, and then 99% of the people go happily with a kid in the hand. Whereas in your case, a lot of people with a lot of stress, strain, and other people, and of course, as you said, majority of them get treated, but still there is always a fear of the recurring back of the disease, and some people unfortunately don't survive. So when you chose oncology, did you thought of, had I become a gynec, maybe I would have been happily, delivering kids and make people happy? Did that
never, sir, never. To be honest, it never crossed my mind, not even now, because even before I joined oncology, as you said, the perception was such, and the gravity of the situation, people used to say, people will keep dying here and there, and but it never crossed my mind. I was never dejected or felt that okay, I should have chosen an easier profession, because as I told you, I like the challenge that a patient comes and trusts in you and believes that, now cancer previously and even now it is considered like there is a timeline. So you're always fighting against the timeline, trying to prolong the life or totally erase the this thing boundary. So that is a challenge which I encounter on a daily basis, and I enjoy going through the process with the patient, being there for them and doing my best to get the best outcome. So for me, being even at the start or even today, it was never a question, and it will never be, because for all the perceptions people have, I see enough number of patients getting cured, and it is always a miracle for me that because to be honest, even a stage 1 cancer, except for say thyroid or breast, maybe some other 1 or 2 other cancers, no one is going to give you a 100% guarantee that it is cured. Today we are able to give 100% guarantee for stage 1 thyroid and breast cancers that you will get cured. So that is what I get to see. People who come in stage 2 or stage 3, and I have used all my skill and knowledge to the best of my ability and try to give them the best outcome, and then after 5 years, 6 years, they come with their children and tell me their stories. That gives a lot of satisfaction, and that definitely supersedes any kind of thought of trying to think about other specialties. Every specialty has its own flair and need. I am probably chosen to be in this one.
Okay. Now coming to this, of course, this is also my experience. Not only in case of my daughter. Generally, whenever we go to the hospitals, you see the type of assurances. Like when I talking to you, are very very pleasant and smiling and talking. In fact, I have seen your videos also. You are always pleasant, and of course, that's one's own nature. In corporate hospitals, not only oncologists, all other streams of doctors also, I find them under tremendous pressure, in the sense that because of the number of patients which they attend to. Like in my daughter's case, we used to wait for 2 hours. Can you imagine 2 hours after taking an appointment? Online, we used to take an appointment, say 11 o'clock we used to take an appointment, still go there and wait up to 12:31 we used to get our turn. And just imagine the doctor used to be so stressed. In fact, I used to see my daughter smiling and that daughter being more stressed. And because of that, we always felt that maybe she never gave a proper time, counseling and giving assurance, talking kindly, talking with a smile on the face. Does corporate hospitals, because after all it's a business for them, and of course doctors it's a profession, but overall corporate it is a business like any other business. They have to train people. So is there any training given to the doctors? Of course they are professionally very competent. How to handle a patient, with kindness, with a smile on the face, giving assurances which are required. Sometimes they work more than the medicines. Because I have personally dealt with Dr. Trehan, as I said, since I worked in Escorts group. He is under tremendous stress. He used to give only 2 minutes, but you have to give it to him in 2 minutes. He talks so positively, convinced. My father was 72 years old when he went for open bypass surgery. In 2 minutes he convinced him, and my father came with a lot of confidence. He said for 72 years he didn't have any problem. Naramurthy, you are a Palwan. You can withstand. And my father was hesitating, shaking. After meeting Rajasthan for 2 minutes, he was ready for operation. And he underwent operation, and after that 10 years he survived without any problem. So does doctors get a training themselves, or does the hospital train the doctors? Okay, you are a very competent doctor, but the feedback, somebody like me, every time I gave a feedback, and I gave a very feedback very openly, but this doctor is really stressed out, and there is no positive waves from the doctor. Whereas like stage 4 cancer patient is smiling and happily coming and looking for some assurance, which is not coming. So what hospitals can do and what doctors themselves can do to address this issue, if you feel that it is an issue?
I cannot speak for the whole community as such, because it's variable.
Yeah.
But as you said, it is very important, it is very essential. Whether it is taught per se, no, to be honest, not in a way which you would feel. For example, the grooming happens for an MBA candidate or a hotel management candidate, or maybe some engineering post-engineering students who undergo training before they start working in these corporates. Or I have a friend who's into his soft skills manager. He trains a lot of people in soft skills, etc. So he runs a lot of these programs in various companies. In medical field, unfortunately, there is no specific training program as such. Yes, we are aware, every doctor is aware of how he has to be and how he needs to be. I think it has to be a personal choice and decision taken by the doctor himself who is treating, to understand and empathize with the patient. See, there is a person sitting in front of you. You have to understand how lucky you are. You are not sitting on the other side. Okay, and you are so blessed to be treating them. They are the ones who are suffering. We just get a stomach ache and our mind is blown, and we cannot tolerate that. The amount of suffering these cancer patients undergo, it is really very difficult to comprehend. So the doctors, especially oncologists, they should keep that in mind, and no matter how difficult it is, take time, or at least train enough people. See, it is difficult, for example, for all doctors to give so much time. I was in 3 surgeries today and I saw 10 patients. So obviously I couldn't give some time. Maybe some patient might feel that I couldn't give him enough time. But I have another 2 assistants with me. Both of them are well trained, 7 years in oncology. I have trained them very well about how to speak to the patient, how to clarify their doubts, and so on. So it is ideal to form a team. See, sometimes a doctor may or may not be able to spend so much time, but the best way out for this is the same doctor can form a team, or the corporates. In the corporates, hospitals can have, they have PREs, that is called a patient relationship executives. They are there in various hospitals, but they are usually a non-medical person. It's ideal to have a medical person or a trained nurse. That would be the best thing to have exclusively for counseling the patients. Not that doctor will not do his job, but whenever the doctor has time, he'll go about it. And beyond that also, the support staff, if they are around to help, that will help in a big way for all these patients who are waiting and or who are stressed, etc. Or who have further doubts. I might have explained it twice, but some people need it 3 or 4 times. Then these trained staff, they help a lot. So that way I am able to, sort of satisfy most of my patients.
As I said, it all depends from person to person. It's not that
we don't have a training program for doctors as of today, but I'm sure it is needed, and even in the curriculum it may need to be inculcated because of the number of doctors that are needed and that are being trained. See, there's so many doctors coming and the competition is so high, and people may lose sight of the fact that how they need to go about it. The objectives may be changing, okay, in the sense, okay, you need to get more patients or whatever, the money may be one objective, so you may lose sight of what you should really be doing. End of the day, your job is to care for the patient and give the best treatment possible. So that should be the primary foundation for every doctor, and definitely the way how to speak to a patient. It is actually there in the books, how to, and only thing it is not focused upon as much as probably it is needed, and I think it is time even in the curriculum to focus on that. And as you said, for busy doctors, like probably even Dr. Trehan is a wonderful orator, but in addition have teams who help you out, and that helps the whole system in a big way.
Because as far as I'm concerned, as I said, that almost every time I used to give feedback, I always used to clarify that it's not complaining, it's a feedback given to you for improvement. Not only I of course have done directly to the doctor, but so many things I see, sitting outside, this, that. And of course we visited 2 hospitals. One hospital was not that receptive, but the second hospital, of course I don't know to take the names, but the second hospital was so receptive. They have changed so many things, small little things like building, this, that. Even can you imagine you have to stand for half an hour in the building? I said, why should I stand? UPI payments I can make. Why should I stand and give my credit card to him? And the hospital has immediately implemented that. So patients should also give feedbacks, because doctors themselves may not be knowing, hospitals may not be knowing themselves. If the patients give feedbacks, if the hospitals and doctors are positive, they definitely try to improve. Not that people don't
quite
want
a few
to improve.
hospitals are able to do that now.
Yeah.
They are getting feedback, and the objective is to improve. I think at the execution implementation level it varies.
Yeah. And in fact, I want to tell through this to the patients also. People always hesitate. Maybe people will not respond. In fact, unfortunately, even the day my doctor passed away, the doctor in the ICU, very senior doctor, by his age and other things, he's a very senior doctor. The way he told me that news itself, then immediately went away. It really shocked me. And I have, again, I don't want to take the name, but I written a mail to the group chairman, who's a very, very popular figure. It's almost running into 3 pages. What is this behavior? You are telling a 62 years old man about the passing away of a 30 years old man. You are not trained your doctors. What for you are such a big group? Can you imagine within 48 hours? Not only that gentleman who was like a superstar in your profession, he constituted a committee of 3 members, senior most people. One is the executive director level guy, and another 2 doctors. They called me to come and discuss. And I said, whatever I have to say, I said in the mail. Now I don't want to come to the hospital immediately after this happening. But hospitals are receptive. Unfortunately, the patients, if they feel something is lacking or something they didn't like, just mention what is there. See, doctors also, after human beings, they do error by mistake. They might have behaved in a certain fashion because of stress or whatever it is. If we give feedbacks, then they will improve. If they don't improve, that is their own problem. Now coming to what we have seen in US and European countries, there's a lot of record maintenance and dissemination of that information and records to the patients. Of course, things have improved in India, but still, I think we are not at par with them. What is the reason for that, and when will we at par with them as far as the dissemination of patients' information is concerned?
Yes, we have a long way to go in that line, especially dissemination of reports. But today, most of the corporates, most of the hospitals have HIS, hospital information systems.
Okay.
So all the patient data is incorporated into it. Okay. So the information is available. Enough, material is also given to the patient about their treatment, etc., etc. So the documentation is there. Whether they comprehend it enough in a way they can really understand is variable.
Yeah.
So whether the understanding of it also has to do with the literacy, understanding of the patient. Yes, in the urban population here, or even up to tier 2 cities, we are able to see that the patients may understand to a good level. In the big cities, yes, but even here we get a lot of patients from villages.
Yeah.
No matter we ask them to take a decision on the treatment, they always say, you tell us what to do and we'll go ahead.
Okay.
So the doctor becomes their
advisor and
confidant. And so that is how it is. But it is improving because there are lots of medical legal issues which are happening, though it may not be quite public. The number of medical legal issues which are happening in India has rampant. It has increased. Some legitimate, some illegitimate, but it is increasing. So documentation has improved, and doctors and staff, everyone is trained. There are systems like MBBS, National Accreditation Board for Hospitals, which has it scrutinizes the hospital, and all the paperwork has to be perfect, and insurance companies have made it mandatory that you have the NABH approval to get yourself empaneled for their insurance. So it is improving. So I'm sure in the long term, probably in a decade or so, we'll come slowly to the system of paperless, and probably how they'll incorporate these medical records is something we have to see. It is a big, long process. Especially the difficulty is on the scale, because the population is so big. You cannot have, it is difficult to incorporate everyone, and not everyone is equally literate. The literacy is an issue. So these are some factors, I think, which are hindering.
Okay. Now coming to enlightening people, educating people, and I have seen some of your videos on your Facebook. You're doing a great job in that. And apart from that, whatever you're posting in your Facebook, is there other activities you are doing for awareness in cancer amongst the people who are not patients as of now, to educate people, and or any special things done by you or by your hospitals you are associated with?
Yes, we keep doing regularly. We have these camps. One is the government-run camps, which one of us occasionally goes to, depending on our schedule. Then we have meetings with doctors and with general population, with different companies, where we talk about what I've been speaking over the past 1 hour, mostly on the types of cancer, what is cancer, what are the treatments available, when to consult a doctor, what are the symptoms we should be aware of or be alert about. So these are the programs which we do probably once in a month or so. For the hospital we do variously, but I think the reach is more with social media today, with the advent of the various platforms, be it YouTube, Insta, Facebook, etc. The reach is higher. I just make a 1-minute video or a 5-minute video today, and then there are 1,000 people who have seen it. The reach is higher than me going to a big apartment complex where I need to do a lot of marketing and then pull out, say, 500 members in a big complex, or maybe 300. So instead I put out a video, I'm reaching 1,000 people or 500 people over a longer span. So I think the approach to that is changing, and this platform is giving me that opportunity to reach out to more people and help them understand that it is time that we focus, of course, about know the treatments and be aware of it, but more importantly, what I would like to focus in my lifetime is on the prevention aspect, because that is something which is in our hands, that is possible, and people are understanding it. So I hope it reaches out to more people, and that is, of course, the most difficult part, unfortunately, making a lifestyle change. Even for me, I know it took to get you start a habit and to continue that over a long term, and make it be it use. I mean, because though it is useful, we know it is difficult to follow some habits. So it takes a lot of time. So we all need people, especially if doctors can motivate you and push you towards having that healthier lifestyle. Nothing like it.
Okay. Now coming to the last question, that the personal, coming to your personal life, how do you relax from this stressful working schedules, and do you pursue any hobbies, and how do you relax?
To be honest, I really don't feel that my work is stress, or it is really a difficult thing, or something which is tiring. Yes, everyone has limited energy levels, so there is a level to which where you are not, and some days it is overwhelming, the amount of work. It is not the kind of work, but the amount of work is overwhelming. So it is, I'm most of the days, 99% of the days, I'm always enthusiastic and motivated to come and work and go, because I'm passionate about it, and I'm lucky to live my passion.
Okay.
But definitely we all have to relax, and I do make it a point on a daily basis. I exercise, no matter how busy my schedule is. The worst is at least doing 10 Surya Namaskaras, at least 15 minutes of some small workout. The best is playing an hour or two of tennis or cricket or whatever game I like. So this is what I get on a daily basis. I try to do that mostly, and I do some form of meditation. That too I do daily, even in the morning or evening, whenever I get time, at least for 15 minutes. The other thing I think I definitely need to improve on is my social network. I do get to spend some time with family, that is routine, but more time with friends, and because it is actually, research has shown that the most important factor for a prolonged or a long life, improving the longevity of your life, is social connections. Improve your social muscle, because we are all human beings are social animals. We all like to meet people, interact with people. So having a coffee with a friend is a lot more beneficial than, you know, sitting by yourself and doing some work. So I think that is one aspect I would love to improve. So that is how I de-stress myself. And
Great. Lastly, what advice you want to give to all the people, especially youngsters, to keep themselves happy and especially to keep away from this dreaded disease?
Yes. So this is my most favorite part, and as I told you, I'll think twice or thrice. I've brought it up already. The most and the best way to treat cancer is to prevent it. One thing which no one understands or no one can quantify is stress. Unfortunately, no one has put out to say this is one risk factor, which is, I think, it is the most important risk factor compared to all, more than smoking, more than poor diet, more than any other thing, is stress. Yes, stress, we put it out in a simple word, but stress can be mild, stress can be something which is nagging for many days, but at the corner of it, or it can be an acute stress. See, the acute stress is always something the body can handle. Suddenly you have a deadline, you have to do this in 2 days, you're running and you're not following any schedule or taking proper food or exercise or anything. All that is fine. Chronic stress is something is your lifestyle. You know, on a daily basis, are you making time to do this? Are you making time to do exercise? Are you making time to, you know, relax, rest, you know, feel good, do whatever you like? Okay. So all these aspects, people get busy in their lives and, you know, they don't focus on this aspect. So that causes stress because they have these loans to take care, they have some medical issues, their parents have some problems. All that is always there. So we should find some ways to de-stress ourselves, as you just mentioned, whichever way it helps, because problems are never going to go. They'll always be there. That is part of life. So let them be just a part of life. They don't make it a whole. Especially youngsters, yes, you want to achieve, you know, there are different kinds of achievement. Monetary aspect is one, personal aspects. Also focus on yourself, okay. Try to understand that it is all a package, so you don't fill it with one aspect and, you know, you're stressed about the other aspects. So try to make time for everything. Try to follow your passion, do what you like, irrespective of what the monetary gains or others are. So these are some aspects in general which youngsters can focus on. There is a time for everything, because as you said, when I prepared for my medicine, I used to study 18 hours a day. It was almost for a span of a year. I had no social life, I had nothing literally. 18 hours a day and sleep. Take small breaks in between. I didn't even interact with my family members at home. So that was the kind of dedication it required for the kind of work I wanted. But that was not a permanent thing. That was a short period because that was my aim. So yes, people are into different kinds of things, but so to prevent cancer, most importantly, focus on your whole lifestyle. Youngsters, stay away from habits which are addictive, like smoking and alcohol. Smoking an absolute no. Alcohol, yes, I won't say it's a fashion today. Once in a while it's all fine, you know, having a drink with your friends once in a while is not an issue.
But drugs is more dangerous.
Oh yes, of course. That's a whole different topic. But as such, I mean, these are the things I think youngsters should focus on. And to prevent cancer, it's not so difficult, but you need to work hard, because today everything has become easy. Everything is in our hands, the whole world is in our hands. With just a click we are able to get immediate food, processed food, which is with junk food and fast food. So people are becoming lazy. Kids, they are getting all the entertainment in their cell phone. They are not going out and not having enough physical activity. Youngsters and even older ones. So it is time we understand that this kind of lifestyle is not helpful in the long term. So start developing habits which are useful. Slowly inculcate them one by one into your daily life. Starting with some form of exercise, at least half an hour to 1 hour a day, then some form of relaxation, being it with friends, meditation, yoga, whatever helps. Focus on the food we eat. No one can make a zero junk or fast food diet today, but still as much as possible inculcate fresh fruits and vegetables and raw diet into your meals, which is high in antioxidants. Then focus on these aspects, and I'm sure any habit, it takes a lot of time for anyone to develop and regularize. But once we start getting, we are all influenced by the Westerners, as we are aware. All these fast food chains have come from there, and it has become easy. But we all need to definitely work hard, because the outcome is quite grave. Because I see patients on a daily basis who are unnecessarily suffering, and they come and ask me, why has this happened to me, and so on and so forth. I cannot tell them it is because of the samosa which they had on the roadside 15 years back, or their habit of having oily food for 10 years or whatever it is. So try to be a little aware of these aspects, and focus on your health, be aware of your health. Cancer is not something you want to experience or even have something in your life. So on a regular basis, develop these habits. Sleep is one thing I think many of the people neglect. It is a very important mechanism for us to rejuvenate and improve. So focus on these habits, develop healthy lifestyle habits, and I'm sure you'll all be away from cancer.
Thank you very much. It will be so useful, Dr. Vamsi. I tell you, for the last 10 months or so, we are working, I and my wife and my family is working, whatever way we could help, the society, especially related to cancer. I'm talking to so many people and trying to be part of NGOs or other people for spreading the awareness about cancer, and most importantly to advise the cancer patients and the caregivers, because we have gone through it, and now we can authentically say that how to lead a life to the fullest. Even if you are having a cancer, nothing is lost. As you said, majority of the people will get remission, and of course few unfortunate people may not survive. Even in those cases, through my daughter, what she has done, we can say whatever life is left, live happily. That is the message which we want to spread. And in this connection, I wanted to, in fact, interview an oncologist, and I was trying so many people in Delhi, but everybody is so busy, non-approachable, and I came across you and I talked to you, and in the first attempt itself we said, okay, we will do it. Then I was waiting for coming to Vizag, because this marriage is there. So my object actually was coming here was for 3 days especially. One day I dedicated that I should chase you, catch you and do it, because marriage of course is important. I said equally important is talking to you, and you are so kind to spare time after 3 back-to-back surgeries. I can understand how stressful it is. And then you said that you had OPD of 10 patients. Then in fact his daughter is not well. He went from the hospital to her house and came back again to meet me and interview for the last 1 hour or so. It is so nice of you. This video will be very, very useful, and this is going to be a trusted possession of me.
Thank you.
Because of all the interviews which I have done, I must say this is the best one from the utility point of view. Of course, every thing which I do, of course, it is achievers. But the focus is to enlighten people, and especially youngsters, how to motivate them. In your case, it is more important to motivate people to stay away from this and see that they don't suffer this dreadful disease. And the people who are suffering, how good care they can take, and you are doing great things. And if I and my family can do something in the programs which you do online, offline, we are always there for you as caregivers and people who have gone through it. We can share our experiences, and then we also can motivate along with you other patients. Thank you very much.
Thank you so much.
All the best.
Pleasure.
Thank you.